Yeah. You know, you said the word diagnose several times, and that's so true. A good friend of ours who's on the show, and he works in Washington D.C. and helps to get resources out to families from a very national, federal level. He coined this phrase. He said he didn't make it up, but I always credit him for it. It's called diagnose and adios, because that's what so many families face when they
Hmm.
get that diagnosis. Yeah, thank you for sharing that, Debbie. Bill, I want to come back to you real quick. You know, you guys have shared, the goal is really to make Sisters Oregon the healthiest small community in the U.S. Can you share what that looks like to you and how living well with Dementia Sisters is going to make that possible?
Yeah, of course. So I mentioned earlier in the podcast about isolation, and we feel that by addressing dementia to start with as something that should be out in the open, it should be something we talk about in the cafes. We should do educational seminars. People should bring their dementia partners with them out into the public and talk about it. So we find that as a real important thing. And the reason why this is it's a little piece that fulfills a bigger need in the community. So we know that if we address this on a small scale, we'll be able to expand into more services on a larger scale to make us a healthier community. If we are able to provide in the future, we have big plans, and we want to be able to provide some respite care for the care partners. We would like to do more educational outreach. We like to do adult daycare. We would like to make this as a bigger part of the community where we can address dementia and other senior health issues. There's an ongoing need, and as you know, people want to age in place. And without a healthy community to support them, people will not be able to age in place successfully.